In this case, we've made the decision to treat the upper left central incisor, which has advanced internal root resorption apparent apically. Here's the clinical image, and you can see aesthetically it would be quite a challenge to replace that tooth. So under the microscope, as we do all procedures under the microscope, we make a little opening in the back of the tooth. And what I tell my patients is that because we're dentists, we do everything upside down and backwards. This seems to give patients a little better understanding of what we do on a daily basis. So cleaning out the tooth was challenging, particularly because of the apical segment beyond the resorptive defect. I packed and I placed calcium hydroxide inside the tooth. This was also difficult, getting the calcium hydroxide dressing exactly where I wanted it. The medication was periodically changed over the course of several months, and cone beam scans were taken to see where the medication was and where it wasn't. On the advice of a colleague, I extended the access opening lingually to facilitate the vertical condensation of the root filling material, in this case the Brasseler bioceramic putty. On top of the bioceramic putty, I placed a composite resin core buildup. In hindsight, I wish that I had placed a fiber post along with that composite resin. The final radiograph shows that resin buildup along with the much more radiopaque bioceramic putty. To me, the CBCT scan is really the only way that you can adequately assess how well you've three-dimensionally obturated that case. And the starkly radiopaque material is the Brasseler bioceramic putty. Now we're looking in the sagittal plane, so we're moving from ear to ear. And in the coronal plane, we're moving from the back of the head to the nose, or vice versa. And now, using the measuring tool, we can accurately determine that that buildup is in fact exactly 10 millimeters deep. I'm on a variety of social media outlets. In addition to the website, you can find more videos on youtube.com/Atlanta Endodontics. We're on Facebook as Atlanta Endodontics. We post clinical images only on Instagram /ATLendo. And you can follow me on Twitter as Atlanta Endo. And if you've made it this far in the video, thank you very much.